Hello everyone. Now today we'll be discussing about HIV/AIDS. HIV/AIDS. There has been a lot of development till today in HIV/AIDS, and HIV/AIDS is itself a bad news to everyone, whoever there is present in this world. But due to the development of the science and due to the development of the medicine till today, there are a lot of good news that has came across in HIV infected patient. So what are the good news now? So let me tell you one by one, and then I'll discuss why these are the good news, and we'll explain a little bit as well. If anybody who is HIV infected person is there, and if he or she is going to listen this video, then please make this information available to all the people that you know. This is not only for the HIV patient but also the people around them, the general population. They have to also understand this, what we have developed in the course of time in HIV patient. Okay? So we are going to discuss about what are the good news for HIV patient. The good news are now HIV can be cured. You will say, doc, you are joking. No, I am not. Actually, there are few cases that has been reported, even one publication in the Nature, that in London, in UK, they have tried bone marrow transplantation. What they have done, they have selected the patient who need the bone marrow transplantation, but they were HIV infected. What they have done during transplantation, if you have no any idea about HIV, then there are a certain group of people in this world. They are intrinsically, they are inherently by their gene resistant to this HIV. Means there are some Jewish people, a group tribe of people, they are not infected with HIV, even they are virus enters into the body. What is actually HIV? HIV is a virus that enters in your body, and it doesn't going to make you suffer itself. What it do is it is going to attack your immune cell. Since your immune cell get damaged and shut down, then opportunistic infection that occurs to you is responsible for your death and morbidity and mortality. So what was concept in this, that okay, when we are going to transplant the bone marrow, then modify the gene, get a mutation, there is a genetically engineering mutation in the immune cell, so that when the bone marrow has been transplanted to that patient, it was gone into them, immune cell was production has gone, but that immune cell is now mutated. And since there is a mutation, now HIV virus enter into the body, but it doesn't go and infect the immune cell, mainly the T cell. The usual cell that affect the HIV virus are T cell and macrophages. They have genetically mutated. Now, since the mutation, the virus cannot enter into the cell. Since it is not entering into the cell, it is not affecting the cell, and your immune cell, T cell and macrophage are safe. Since they are safe, virus will enter into the body, but they will again go out. After it will be washed away after completion of life cycle. So that is how it's occurred. It is not multiplying. So by this method, you can be cured. Although it is very expensive method, there are a lot of issues as well. That bone marrow transplantation, it has been only tried in 2 countries. One is in the UK and another is, I think, in Netherlands. So only few countries have been tried and only few patients. Although we have a good outcome. The thing is that since it is a highly expensive, sophisticated procedure, there are also other side effects like graft versus host disease have been found in one patient. So that is not feasible to the general public. But what is more development, what is more amaze me, what is more important in today's point of discussion, today's point of medicine here, is that undetectable is equal to untransmissible. This is very amazing. It means that, this point means that if you are HIV infected person and we have detected you, now we have started on a treatment and achieve your virus level. This is our primary goal of therapy of HIV patient. What we start the heart highly activated viral therapy is to achieve your virus level undetectable. Okay, so once we have achieved your virus in your blood, in your serum undetectable, it means that if you are undetectable, then you are untransmissible. Means you cannot transmit the virus to the other by having sexual relation, even by having sexual relationship with a normal person who doesn't have HIV. And if you are going to have a sexual relationship without protection, then also it has documented that no HIV has been transmitted. So it's a very, very good news and very, very big news for these HIV people. What does it mean that? It means that if you are infected, we have detected you, we have treated you, now your virus is undetectable. Unless you are going to transfer your blood, you are going to blood transfusion, other mechanism of transmission is zero, low. It has found zero. So HIV patient, now you can live with HIV patient, you can work with, although it was previously also advises that there was a social stigma that okay, somebody has got HIV, now you will get transmitted when you sit with them, you will kiss them, hug them. But even if you are detected and we have treated you and you are on medication, then even if you are going to have a sexual relationship, then also without protection, then also you are not going to transmit this virus to a normal person. I think this is a very, very good achievement what science has achieved. So this is very big news, and it is fact. It has been well established. A lot of clinical trials has been done, and they have been published, and it has been found that there was zero risk of transmission after your virus in your blood become undetectable on medicine and have a sexual relationship with a normal person who doesn't have HIV without protection, and found there was no HIV infection in normal person. This means that the social stigma towards the HIV patient should be now improved. Rather, thinking any HIV patient who are infected, who are not been, or you have suspicion of that you have a high risk behavior and now you have HIV, please go to the doctor. Please come to us. We have infectious disease specialist. We'll treat you. We'll make your virus undetectable in 6 or 7 months. If it is achieved, you are on the regular therapy, you are taking medicines sincerely every day without any fail, then we can assure you that it is just a manageable disease like diabetes and hypertension. A patient with a diabetes, his diabetes is on medication and he is living a normal life. Just as that, HIV can be also treated as diabetes and hypertension. It is a manageable disease, as a chronic disease, and you can have a normal long life. And after this development, I think social stigma towards HIV patients should also be changed. It should be changed in the community, in the society, in the working place, in the hospital, everywhere. Because if you are going to manage him properly and he or she is honest and adherent to the treatment, virus becomes undetectable in his blood. And since the virus is undetectable in blood, he becomes untransmissible in kissing, in having sexual interaction, in having everything. Just make sure that blood should not be transfused. Our blood product which should not become in contact to your blood. That is the important point of this. I hope you have understood. This is a very big news. Then there is a highly active antiretroviral therapy. At present, for HIV treatment, we have developed lots of effective drugs, and they are very useful with minimum side effect we have, and we can manage it very efficiently. Okay, then there are a lot of vaccine trial which has been occurred as is going on. So this are also this is going on, but it is only on trial. Some of them had success, some has been reported, some has not, but it is only on trial. Many clinical trials are going on for this also. Okay, hope this will be a success in future as well. Then there is a post-exposure prophylaxis. We have very effective post-exposure prophylaxis. What does it mean that? It means that somebody who had IX behavior, got contact with the HIV patient, have sexual relationship with the HIV patient, if is a medical person, have prick while managing the patient, you got a prick from your needle prick when you are managing the patient, normally nurse, some of the medical doctor, medical officer, Then if we are going to start your treatment within 72 hours or as soon as possible, then within 28 days, if you have got the virus in your body after exposure, it can be cleared out. I will repeat it again. It means that if somebody had any sexual high risk behavior, you have got in contact, you think he or she is HIV positive, or you have got the history from an HIV positive patient, now we have a treatment by which we can make you cure, or the virus can be cleared out from your body within 28 days of treatment. And that is what the medicine, and we have a very effective medicine today at present. Okay, this is post-exposure prophylaxis. For post-exposure prophylaxis, you have to understand that there are two types of HIV, HIV-1 and HIV-2. These both are found in Southeast Asia. So we cannot give you a drug that will not cover HIV-2. So that should have proper knowledge. And if you are having suspicion, you come to the infectious disease specialist. And problem is that HIV-1 treatment includes NRTI and 2 NRTI plus 1 NNRTI, or you go for integrase inhibitor or protease inhibitor, whatever you choose is convenient according to your health condition, your side effect, your money, everything depends for choosing the regimen and side effects as well. But when we are going to cover post-exposure prophylaxis, then we have to cover both HIV-1 and HIV-2, and for that you can use tenofovir, emtricitabine and dolutegravir or raltegravir combination. That will be a better NRTI, 2 NRTI plus 1 integrase inhibitor, and that will cover both HIV-1 and HIV-2, because HIV-2 is not covered by NNRTI. That efavirenz, nevirapine, delabradim, this doesn't cover HIV-2. So combination of tenofovir, emtricitabine and efavirenz will not work. In that situation, you have to give tenofovir, emtricitabine plus either dolutegravir or raltegravir. I hope you are able to understand this. Okay, somebody, if you are a medical doctor and somebody comes to you, then you have to make sure that you are covering both and you are giving this combination. Okay, there even pre-exposure prophylaxis can be taken. That is really good news. I think there is a lot of thing has been developed in science. It means that even if you are thinking that you are going to some high risk places, high risk behavior you are going to involve in, and you have the chance to get the HIV infection, even a medical doctor are going to be taking care of the patient, and you think that it is a very vulnerable to get that break or something there, or somebody is going to Thailand to have be involved in high risk behavior or have been involved, then they can take pre-exposure as well and continue the medication. That can be also be done. Okay, it is not a good way to practice actually. The better drugs and alternative drugs are available to us for the treatment of opportunistic infection. This point indicates that it means that we have, HIV infection occur, HIV virus goes inside the body, then it goes multiplying. It affects the immune system, immune cell. Since the virus goes up, your immune cell goes down and down and down. Now, since your immunity has shut down, your immune cell CD4 count has been gone so low, so that you are having this opportunistic infection. And the opportunistic infection, there are many. According to your CD4 count level, how much it has gone low, according to that you are at risk of having that opportunistic infection. But the good news is that we have better understanding of opportunistic infection, what can be the possibility, we have a better diagnostic method, and we are able to cure you with the better drugs. There are a lot of first line alternative drugs and a lot of things there to cure this opportunistic infection. So once we have cured your opportunistic infection, then we can start your highly active antiretroviral therapy, and in few months we'll achieve your undetectable virus load in your blood undetectable. And now you can, since your virus is high, immunity is low, now when you are going to suppress the virus with the medicine, your immunity automatic will start to come up. When you are going to have the immunity CD4 counts cell more than 500 cell, then you are as a normal person like me, like others. They all have 700 to 1500 CD4 cell count. So since your CD4 cell count is normal, you are normal. HIV virus is not going to do anything by itself. It's damaging your immune system. Your immune system gets shut down, and because of that you are having this morbidity and mortality or the disease and death. Everything is due to the immune system that has shut down. It's not the HIV virus. Since you have managed it and your immunity is normal, you are equally risked as a normal person of having any disease, or you are equally have an immunity in your body that protects as it protects me, as protects other normal person. It's just the CD4 count cell that should be comes to your high level, normal level. Okay, so you have understood that also. Now you have to understand one major thing, and this is true mainly to the medical doctors, that we have now better understanding of this IRIS, immune reconstitution inflammatory syndrome. When CD4 cell goes down, now you will have opportunistic infection. Now since you are having opportunistic infection and your immunity is low, it is not going to fight and you easily get with this infection. Without treating this opportunistic infection, if you are going to start the hard therapy and HIV treatment, then what happens? The infection is there and now this virus is coming down, immune cell is going up. Since immune cell is going up, immunity is going up, your immunity is boosting up. Now if he or she, if the immunity found there is any infection, it will attack the infection. It will try to clear out this infection. In the process of it, the immune system gets so involved in it, so you will have a syndrome called immune reconstitution inflammatory syndrome, and that is actually bad for the patient. That is actually worse for the patient. The patient will get worse and will be deteriorated. So you have to understand it very carefully and should maintain a gap. There is actually a clear-cut gap. I will discuss later on in later lectures. Then what are that if you have a cryptococcal meningitis, you need to maintain 6 weeks of gap. If you have a pulmonary tuberculosis, you at least should maintain 2 weeks of gap. So there are certain opportunistic infection, and for that you have to maintain a gap. Should we delay the start of HIV medicine? Okay, so that is of understanding of immune reconstitution inflammatory syndrome. I hope this good news for the HIV patient and for the general public will be helpful, and it is necessary that social stigma towards HIV patient should be now removed, because he or she can be managed with as a normal chronic condition as diabetes, hypertension or any other chronic condition, and have a normal long life. Even I remember one my patient who was a doctor, he got accidentally developed HIV, he neglected it, and later he took this post-exposure prophylaxis, he developed HIV. He came to me with wife. They were actually very cooperative. We start the treatment, make it undetectable, then even they are now having normal life and normal sexual relationship, even without protection also. And important thing is that they are planning for baby as well. So even a HIV infected person can have a baby, and the baby can be uninfected from this virus also. So there are a lot of development in HIV infection, and there are a lot of good news which I think will be helpful to you. Thank you so much.